Today topic of discussion chronic pyelonephritis. Chronic pyelonephritis is the chronic inflammation of tubulointerstitial tissue leading to scarring of calyces, pelvis and renal parenchyma. So chronic pyelonephritis is the inflammation of tubulointerstitial tissue leading to scarring of calyces, pelvis, renal parenchyma. The chronic pyelonephritis is the important cause of end-stage renal disease. This one causes important causes of end-stage renal disease. Next, etiopathogenesis of chronic pyelonephritis. The main causes is reflux. So, main causes is reflux nephropathy. That is the chronic reflux associated pyelonephritis. Chronic reflux associated pyelonephritis. This reflux nephropathy is most common cause of chronic pyelonephritis. This occur due to superimposition. This one occur due to superimposition of a urinary infection on congenital vesicoureteral reflux or intrarenal reflux. This reflux can be unilateral or bilateral. This one occur due to superimposition of the urinary infection of congenital vesicoureteral reflux or intrarenal reflux. This reflux may be unilateral or bilateral. Second causes chronic obstructive pyelonephritis. This occur due to recurrent infection superimposed on obstructive lesion which leads to renal inflammation, parenchymal atrophy and scarring. So second causes chronic obstructive pyelonephritis. This occur due to recurrent infection superimposed on obstructive lesion which leads to renal inflammation, parenchymal atrophy and scarring. Next, morphology of chronic pyelonephritis. First one is cross. In cross, it can involve either one kidney or it can involve in both kidney, unilateral or bilateral. The size of the kidney decreases due to irregular scar. This scar present in upper and lower poles due to intrarenal reflux, which is more common in the upper and lower pole. So this cross involved either one kidney or both kidney. One kidney means unilateral, both kidney means bilateral. The size decreasing due to irregular scar, that is scar presented in upper and lower poles due to intrarenal reflux. The scar are coarse and well defined. The scars are coarse and well defined. Next, calyces. Calyces are thickened and irregular with scarring papillae or planted. Next one is microscopy. Microscopy shows the chronic inflammatory infiltrate of lymphocytes. Microscopy shows chronic inflammatory infiltrate of lymphocytes and macrophages in the interstitium. Microscopy shows chronic inflammatory infiltrate of lymphocytes and macrophages in that interstitium, and the tubules shows atrophy. Tubules shows atrophy in some places and hypertrophy and dilation in other places. Tubules show atrophy in some places, hypertrophy and dilation in other places. The microscopy shows thyroidization. Thyroidization is referred to dilated tubules are filled with eosinophilic hyaline. Dilated tubules are filled with eosinophilic hyaline material and it is resembles colloidal containing thyroid follicles. That is why it is called as thyroidization of that renal tubules. Thyroidization of renal tubules. This is dilated tubules filled with eosinophilic hyaline material resembles colloidal containing thyroid follicles. Blood vessels shows enteritis obliterans. Enteritis obliterans, and if hypertension is present, the blood vessels shows hyaline arteriosclerosis. In these blood vessels shows enteritis obliterans, and that hypertension shows hyaline arteriosclerosis. Next, glomeruli showing periglomerular fibrosis. Glomeruli showing periglomerular fibrosis. Then calyces. Calyceal epithelium surrounded by fibrosis. Calyceal epithelium surrounded by fibrosis and dense chronic inflammatory infiltrate. Next, xanthogranulomatous pyelonephritis. Xanthogranulomatous pyelonephritis, it is the one of that form of chronic pyelonephritis. The xanthogranulomatous pyelonephritis, which is unusual, a rare form of chronic pyelonephritis associated with Proteus infection. This one associated with Proteus infection. Next, microscopic of xanthogranulomatous pyelonephritis. Crossly, the cut surface shows large yellow-orange nodules. So, it may be confused with renal cell carcinoma. Okay, that calculi presented in Stockhorn appearance. This calculi presented in Stockhorn appearance. Next, microscopy. In microscopy, the interstitium shows foamy macrophages, plasma cell and lymphocytes. In microscopy, that interstitium shows foamy macrophages, plasma cells and lymphocytes. That is chronic inflammatory infiltrate. Lastly, clinical pictures. It include back pain, fever, pyuria. That condition, pus in urine, then bacteriuria. Bacteria in urine. Clinical pictures include back pain, fever, pyuria and bacteriuria. So this is all about chronic pyelonephritis. Thanks for watching.